A scintillating morning to one and all present over here. The galaxy of intellectuals, guests, academicians, nurse educators, administrators, nursing officers, budding nurses, and my dear friends. It's a great pleasure to have the delegates like you joining from various states of the country and exhibiting your interest and involvement in online platform. I, Mr. Chris Thomas, Secretary of Clinical Nursing Research Society, welcome you all for the launching of CNRS West Zone, as well as our virtual panel discussion on making mental health a global priority through the lens of nurses. CNRS is established in the year 2019 with a very few founder members, and now it is expanded with its branches. We had successfully launched our North Zone on 10th September. Today we are here to launch our West Zone chapter. So once again, I welcome you all to this online platform of official launching of CNRS West Zone in collaboration with ECO India. CNRS West Zone has also organized their first online panel discussion on the theme Making Mental Health a Global Priority on behalf of World Mental Health Week. So before launching the CNRS West Zone, may I call our President of National Executive Committee CNRS, Madam Shashi Bala, to officially inaugurate CNRS West Zone. Let me introduce few significant highlights about Madam Shashi Bala. She is a graduate in science from HME University, Shimla, a nursing graduate from PGIMER, Chandigarh, postgraduate in public administration from Punjab University, postgraduate in nursing from Barkatullah University, as well as she has done her postgraduate diploma in counseling and hypnotherapy. She has overall 40 years of experience, in which 7 years was in clinical in both India and overseas, and more than 30 years of experience in teaching and administration. She's been examiner and inspector for Rajasthan Nursing Council and other councils, speaker and organizers for many national conferences, ICMR sponsored workshops, as well as she's more involved in Brahma Kumaris Associated, that is the headquarter of CNRS, and she's involved in value-based education and mind-body medicine. She's founder president of our CNRS and involved in few research projects. May I invite Madam Shashi Bala to please officially inaugurate CNRS West Zone. Over to you, ma'am.
Good morning. I hope I'm audible to everyone.
Yes, ma'am.
Yes, ma'am.
I'm sorry, there's some technical issues been here. So you all have to wait for me. So let's start. Good morning. It's a matter of immense pleasure that today's virtual panel discussion serves the launching of the CNRS West Zone chapter under the leadership of a vivacious leader, Dr. Rekha Gupta. It's my proud privilege as President CNRS to extend a special welcome to our chief guest of the big day, Professor Dr. Roy K. George, National President, TNAI. We are honored to have you serve with us on this virtual platform. A very warm welcome to the distinguished speakers, CNRS members, participants. I would like to express my deepest appreciation and gratitude to the organizing chairperson, President CNRS West Zone, Dr. Rekha Gupta, and her team. Mental health is not a destination, but a process. It's about how you drive, not where you are going. COVID-19 pandemic has created a global crisis for the mental health, fueling short and long-term mental health of millions. There has been a rise in both anxiety and depression disorders of more than 25% during the first year of the pandemic, and is continuously on increase. This year theme, making mental health and well-being for all a global priority, is an opportunity for all of us health professionals to enhance awareness about which preventive mental health interventions work. Our renowned speakers of today's are with us to elaborate the theme of the day. Expansion is always a need of the time for the growth of the organization. With the last month only, we had the launching of the North Zone, and today it's the West Zone. Slowly and slowly, our society, Clinical Nursing Research Society, is spreading its wings to the other states of India to meet its objectives. So now, just in brief, I would like to share the mission, vision, and objectives of the CNRS. Before I start, I would like to welcome our CNRS, Dr. Suvarsh Khanna, who is not here with us because of the time gap as in the US, and Mrs. Uma Handa, our nursing advisor to the CNRS. It is just because of these two brains, minds, and the nursing leaders that the CNRS came into being. It was officially registered in April 2018 and officially launched in August 2019 on its first national conference at SLM Global Nursing College, Mount Abu. Just to mention, the mission of the society is to promote evidence-based nursing research in clinical practice, to develop the policies and standardized clinical guidelines to provide the evidence-based quality care, to achieve national and international interdisciplinary collaboration, dissemination, and utilization of outcomes of the clinical research studies to improve the quality of nursing care, to enhance the visibility and active involvement of nurses in policy-making decisions at national and international levels. The objectives are to provide opportunities to the nurses with technical support to comprehend research methodology and its clinical applications for facilitating healthcare outcomes. To promote specialization, clinical specialization for empowerment of nurses to improve quality patient-centric care. To explore funding resources for the individual and the group research in clinical practice, and to follow the ethical guidelines as per the regulatory body, to collaborate with other national and international professional bodies to promote evidence-based nursing, and to have the regional chapters of the society. And that's the last objective, and that's why we are meeting here today. During this span of 4 years, we have conducted so many workshops, seminars, and this virtual platform started during the COVID period. And so we are here again today. I would like to introduce to our visionary leaders, the founders, patron, Dr. Pratap Midha, who is the director of the Global Hospital and Research Center, Mount Abu, of which our SLM Global Nursing College is a unit. Our honorary patron, Dr. Suvarsh Khanna, the seed founder, CNRS
program is college में
and SIA.
Good.
Just then, side by side, we have the national executive committees. You can see on the screen the various committees with their chairpersons. And then this is the joint editor, Dr. Suvarsh Khanna. No, sorry. Joint editors, research committee, peer review committee, bylaws committee, membership and the election committee. With this, we started our zones, and first zone, as I already mentioned, we had in the last month, and we plan to have another 2 zones in the near future as well. So that's the official ribbon cutting, virtual ribbon cutting. Best zone.
Hello. Hello.
So I would like to introduce to the members, the president, first of all, Dr. Professor Colonel Dr. Rekha Gupta, Dean and Principal, People's College of Nursing and Research Center. Vice President, Professor Dr. Aradhana Michael, Principal, Choitram College of Nursing. Welcome you, ma'am.
Thank you, ma'am.
Secretary, West Zone, CNRS, Professor Rakesh Joshi, Principal, Ratan Prabha College of Nursing, Vadnagar, Gujarat. Welcome, sir. Then Secretary, West Zone, CNRS, Professor Rakesh Joshi, Principal. Oh, yeah, that's over. Then Joint Secretary, West Zone, Professor Shirja Vijayan, Professor Chaitram College of Nursing, Indore. Welcome, ma'am. Then Treasurer.
Thank you, ma'am.
Dr. Bahubali, Associate Professor, College of Nursing, Bharati Vidyapith University, Sangli, Maharashtra. Welcome, sir. And these are the other committee and the committee chairpersons. Mrs. Sakshi, Chairperson, Education Committee, CNRS West Zone. Mrs. Nasima Shafakat, Chairperson, Membership Committee. Then Dr. Chakrapani Chaturvedi, Chairperson, Research Committee. Mrs. Geeta Bhardwaj, Chairperson, Ethics Committee. So that's all about all the members. I'm sure the members would be increasing day by day, and as we already know, because everyone has to, we have to have more members, so that will be all taken care of by the worthy president, Dr. Rekha Gupta. So I'm all very optimistic. I think that's all about the introduction, just in brief about the CNRS. And in detail, I think you all can visit our website. And there is all the details, what are the programs, and in the detail, the objectives, mission and vision and all, it's there on the website. I'm already optimistic that the CNRS West Zone will keep on contributing very effectively in future to achieve the ultimate goal for which it is established. I wish everyone a successful and fruitful panel discussion. All the very best and congratulations to the West Zone. Thank you.
Thank you, ma'am.
Now I request Mr. Bahudevi to kindly take over.
Chris, shall we start further? Bahubali, you are ready with the slides?
Sir, you are muted.
Yeah, I'm not able to share the screen right now. Host disable participant screen sharing.
Okay, let me ask. You please start. Meanwhile, we'll do.
Yeah, sure. Thank you very much, President CNRS, Mrs. Shashibala Madam, and Secretary Mr. Chris sir, for making this a reality. I shall take this opportunity to host today's event. Good morning, one and all. I, Dr. Bahubali JG, Treasurer, CNRS West Zone, and Associate Professor HOD, Psychiatric Nursing, Bharati Vidyapith, deemed to be University College of Nursing, Sangli, Maharashtra. It gives me immense pleasure to extend a very warm welcome on behalf of CNRS West Zone office bearers, who has clubbed all of us on this day for the virtual panel discussion on the topic of making mental health a global priority through the lens of nurses, which aims to generate the significance of mental health in current scenario and bridge the gap in community mental health services through a virtual panel discussion on common goal. Indeed, it's a comprehensive approach to theory application for evidence-based practice in nursing. Next, the importance of significant personality, who has rich knowledge and experience in the progression of any profession, is enormous. With their blessings, guidance, and path, make the professional journey worthwhile. To introduce such eminent personality midst of us, I call upon respected President CNRS West Zone, Professor Colonel Rekha Gupta Ma'am, Principal and Dean, People's College of Nursing and Research Center, People's University, Madhya Pradesh, to welcome our today's honorable chief guest. Before that, I would like to briefly introduce our zonal president, who has been one among the key person in making this event reality. Her able guidance and enthusiasm in establishing West Zone was instrumental in motivating all our office bearers to organize this August event. Definitely, this event lays the foundation stone for many activities in future endeavor. So here I introduce Madam in brief. Madam, who is a moderator for today's panel discussion, Professor Rekha Gupta Ma'am, Dean and Principal, People's College of Nursing and Research Center, People's University, Bhopal, Madhya Pradesh, and our President, CNRS West Zone. Background, Madam has got over 33 years of experience in nursing profession. Out of that, 22 years, she has been served at armed forces. She has received gold medal at PG level, received gold medal for securing first position in SMDT University, and best thesis award at Masters, as well as gold medal at NNF paper presentation. A few brief highlights of Madam achievements
Sir, you are not audible.
Wholeheartedly welcome you, dear ma'am, and request you to introduce Honorable Chief.
Shashibala, team at Center and other Western Zone, and my dear colleagues, Dr. Rakesh George, special guest. It's my proud privilege to be here and conduct the session. Of course, we do work with our best abilities, but each moment is learning, and we do learn from each other. Today's endeavor is just to focus the attention of we nurses on to the mental health issue, which is a burning problem in society and leading to all ill health overall. And the second part of focus would also be more on how we nurses can lead the way to build mental health of we ourselves and our society. In this series, I would like to welcome Dr. Rakesh George, a very humble person. I personally had been liking your endeavors and had known your contribution immensely during COVID to represent nurses of India, which I personally also would be very thankful to you, sir. To add to many feathers of yours, which we cannot collect, few lines to read about you, everyone knows, but still you are National President, TNAI, and working in the capacity of Principal Baby Memorial College of Nursing, Calicut. Your master's from NIMHANS, and of course, your specialty is related to today's topic. Your PhD in School of Behavioral Sciences, MG University, and one of the senior most professor available right now in psychiatric nursing in Kerala, right? And I thank you personally, sir, that CNRS West Zone is lucky to have you with us. You had been in renowned colleges, few of them like CMC Vellore, the founder principal of college and director of both school and college of nursing attached to MGDM Hospital, Kangsa. You are chief editor, Kerala Nursing Forum, first journal of Nursing Forum, Kerala, and researcher with special interest in dementia and old age, which is the future of mental health nursing. Many publications in national and international journals are to your credit, and of course, you are leading Indian Nursing Council and leading all of us with your vision. I welcome you, Dr. Rakesh George, and we all are eagerly waiting to listen to your views related to today's topic. Thank you. Over to you, Dr. George.
Thank you, Dr. Gupta, for that nice introduction. And warm good morning to all my dear colleagues across the country. I'm really delighted to be here in the launching ceremony of the Clinical Nursing Research Society of India North Zone, so West Zone. And I understand this is the second zone launched by the Clinical Nursing Research Society of India, which had their formal launch in 2019. And 3 years is a very short time. In that, it is indeed a pleasure to watch that you are spreading out your activities through different zones, and many people are joining the CNRS. Like in nursing in India, though we have a large number of nurses across the country, specialized interest groups are still comparably less. There are a few groups like Indian Psychiatric Nursing Psychiatric Society, Society of Indian Psychiatric Nurses, or community health nurses, critical care nurses. But every area we need special interest groups who will be able to push forward the interest of that particular specialty or area. That way, Clinical Nursing Research Society is a very good step, because most of the largest criticism nurses face is most of our research work is in the academic area, or is done by pure academicians who are not working in the clinical field. Whereas clinical nurses are generally restricted to their clinical work and are not able to get involved much in the research in the clinical area. So I'm definitely hopeful that societies like Clinical Nursing Research Society will be able to fill that vacuum wherein essentially nursing is a doer's profession and our main test area is the clinical work. And so when that area is strengthened only, our profession will advance. One of the major blames attributed to nursing is that most of our research is only theoretical or academical. So definitely this movement will help in filling this vacuum. And on the occasion of CNRS West Zone launching, I'm delighted to find out that they have collaborated with the Mental Health Day of October 10th and Mental Health Week, and is trying to discuss mental health, a global priority, through the perspective of nurses. Yes, definitely, we are the largest group of people who are in the healthcare professions. We occupy more than 60% of the health worker force. Still, many times we do not give enough importance to areas like mental health. Like there is some stigma to mental health, or because it is marginalized. But as the days go by, life is getting more complicated. The trends in human life and challenges and problems in human life are changing. Like the pandemic, which has caused a lot of mental health problems. The professionals to look upon this area. And when mental health is taken as a priority by nurses, as we are a majority healthcare workforce, if our attitudes change, if our focus area become more crystallized, definitely there will be a big change. So this is a great topic to be discussed. And as the people, the life experience of people are going up, populations are aging, problems of older citizens and senior people are also getting more relevance to society and to nurses because we are the caregivers in every phase of life. So I congratulate the CNRS for taking this panel discussion, and I am sure this panel discussion will throw deep insights to all the attendees on what are the mental health priorities and how nurses can contribute in making mental health a global priority. I wish the CNRS all the best in this endeavor, and especially for the West Zone to become a very active zone to set benchmarks in their professional activity. As an umbrella organization of nurses, TNAI is always committed to support any genuine research activity. And last year we have launched TNAI National Research Grants for helping budding researchers with financial aid of maximum 1 lakh per year, which is only a beginning as a professional organization to encourage researchers. So definitely any activity which is worthwhile, we will definitely explore the possibility of collaborations and support to CNRS also, because as a professional association, we are not against any specialty organization, rather we support our policies to support any serious effort from any focus group or specialty society. So definitely TNAI will be happy to associate with you. And due to shortage of time, another meeting is waiting. People are physically waiting for me. Actually, the meeting was at 10 o'clock when Chris called me and asked me to be, definitely you have to be there. I finally agreed. So I have to leave. Once again, all the best, and thank you all for this opportunity to be part of this great beginning. Thank you very much.
Thank you, Rakesh George. Rather, we are in Dept and much humbled with your tight schedule. You still tried to meet up with us. It boosted all of us. And thank you so much for offering the TNAI grant proposal, which is my words. You have rather taken it away. I definitely would be approaching and we would step in with TNAI for further collaboration. Thank you so much, sir.
Thank you.
Yes, thank you, Rekha Gupta ma'am, for a wonderful introduction. And thank you so much, Honorable Professor Dr. K. George, sir, for your valuable suggestions and guidance in taking the society way forward. And we assure, sir, that our society will reach many heights in future endeavors. Thank you once again. And we may need your guidance and suggestions in the time of need. So, delegates, now we have reached to the key part of today's program. And I'm sure everyone is curious and eager to listen to the discussion by renowned panelists who are enriched with experience in laying the evidence-based practices in nursing profession. So, dear delegates, keep yourself active to sharpen the cognitive, affective, and psychomotor domain of mind. Hence, here I request once again respected Professor Rekha Gupta, President CNRS West Zone, to moderate the panel discussion. Ma'am, I request you to take over the platform. Thank you.
Thank you, Dr. Bahubali. I take my pride privilege to introduce the speakers for panel today. Can I ask you to project the slides, please? All right. So to introduce first speaker, Dr. R. Sreevani, Professor and HOD Department of Psychiatric Nursing, DIMHANS, Karnataka. Thank you, Sreevani, to agree with our proposal and devote your time and your energy and caliber to be with us this morning. To speak about you and let the audience be knowing about you, you are Masters from NIMHANS 2000 and you are PhD in nursing under National Consortium from INC 2013. You have secured first rank in PhD entrance examination. Congratulations, wow, great. And in National Consortium, of course, 2008. You have undergone Body, Mind, Spirit Practitioner course at Hong Kong University, Hong Kong. Thank you, Sreevani, to be with us. We definitely will try to get your expertise to benefit our audience, maybe today and also in future. You are closely associated with DIMHANS community services and clinical activities. Also to highlight other credentials of yours are, you are well-known pan-India writer for textbooks for nurses on mental health, nursing, psychology, and research. You have secured Best Paper Award for paper titled Integrated Body, Mind, Spirit Group Therapy on Well-Being of Depressive Patients. Good. You have received Florence Nightingale Award from President of India, Ministry of Health and Welfare in 2015. Hearty congratulations, Sreevani. You have received Fellowship of Indian Society of Psychiatric Nurses Award 2018, and you are reviewer for several national and international journals. And I know many more things are left, which we cannot cover here in this short time, but yes, let audience know about you yourself. Can I have opportunity to introduce second speaker? Dr. Jayanthi, working as lecturer, College of Nursing, NIMHANS, Bangalore, Karnataka. Welcome you, Dr. Jayanthi, to our panel discussion. About Dr. Jayanthi, she is Master's and PhD from NIMHANS and is a resource person for TOT and workshops on GF attainment projects in HIV, AIDS, and tuberculosis, which was conducted by INC. She is published in various journals, her papers. She has been a resource person for various national conferences, seminars, and workshops, and she has been awarded ISPN Fellowship at 3rd International Conference at Bangalore 2017. Again, a very renowned and led person in this field of mental health promotion. And we would be really looking forward for your expertise. Thank you for joining us in this panel discussion. Third panelist, Mr. Rakesh V R, who is pursuing PhD and working currently as Faculty of Nursing, AIIMS, Bhubaneswar, Odisha. Welcome, Rakesh, to accept the invitation and be with us. And to tell a little about you, you are a graduate and from Calicut, Kerala, and you've done PG from AIIMS, New Delhi in 2012, and currently pursuing PhD under the umbrella of INC. You have served at National Institute of Mental Health and Neuroscience, Bangalore for 5 years in clinical nursing service, means you have good experience. You have more than 10 years of experience in the field of mental health nursing after doing your PG. You have more than 30 scientific publications to your credit into indexed journals. You have contributed 3 chapters in mental health nursing textbooks. You are reviewer for Elsewhere Journal, which is a great credit nice to know about it. You are resource person for national and state level workshops, and you are organizing team member and resource person for substance use disorder training for nurses in Odisha at AIIMS Bhubaneswar, which has been funded by Ministry of Health and Family Welfare, Government of India. So see how we come to know great people around us, and it's nice. And my thanks goes to CNRS, who thought of expanding its wing and creating zones and reaching to the people with merit. Thank you, Rakesh, once more. Panelist number 4, Dr. Reena George, a well-known person, not only by me, but all of you, who is heading a Department of Psychiatric Nursing at IMHANS, Calicut. She is a very good speaker, and you might have heard her in many talks. To let audience know who do not know her is about certain things about her achievements. She is a PhD from Bharatiya University, Tamil Nadu, Masters from Mangalore, and also Masters in Applied Psychology from Annamalai University. She's holding PG Diploma in Counseling from Calicut University, Certificate Course in Family Healthcare from KUHS Thrissur, Diploma in Community Mental Health Nursing, and recognized PhD guide for Kerala. Wow, so many things. Anything more left to take up, Reena? And I feel all of you are really expert in this field. Dr. Reena has 19 years of clinical UG and postgraduate teaching experience, 20 publications in national international journals, member of Ethics Committee and Institute Management Committee at her place. She handled NISD funded project on substance abuse awareness, which I feel is a very important work. She is reviewer for renowned journals associated with WHO African Palliative Care Association since 2018. She bagged several meritorious awards during studentship. Her areas of interest to work are community mental health, preventive mental health, and mental health of family caregivers, adolescents, and women. Very good feeling to have you, Dr. Reena, amongst us. And let us brainstorm the audience as well as us during this panel discussion. Thank you for accepting our invitation. Thank you. Can I request Chris to project one of the slide which now these are the apparent body language, right? Nothing is said, nothing is heard, but we, each one of us, each one of healthcare professionals can think to introduce the topic. When we see this slide, something struck to our mind, something wrong with people around. And we know nowadays these mental health illnesses, mental health symptoms are surfacing, right? Even our day-to-day dealing with family and with colleagues, a lot of unethical things we do practice, and we come across ourselves also, we bear the brunt related to this. Now, a little statistics about mental illnesses in India and why we have chosen this topic. It is a well-known fact that India is the third largest developing economy. It's emerging, right? We all know, and it's something very good. We are developing, sort of we are advancing, we are developing. At the same time, the side effect of this development also is that we are aging. Currently, India has maximum youths, right? But these maximum youths are perfectly not in perfect state of mental health. And maybe after 20 years, all these youths would be converting into aging people, and we would land up the place where US is right now. So this is our proactive discussion as well as awareness for the benefit of self as well as for profession, right? That we get aware of this emerging problem, which is right now seen only as the tip of the iceberg. If I take you towards the statistics, which you will understand the gravity of the problem. In December 2017, India President Ramnath Kovind ji warned of a potential mental health epidemic in India, with 10% of its 1.3 billion strong population having suffered from one or more of the mental health problems. According to WHO, India accounted for nearly 15% of global mental health, neurological and substance abuse disorder. Can you imagine? Global 15%, India is contributing here also. A meta-analysis of community survey estimated that the prevalence of depression and anxiety could be up to 33,000 people of India, which is very grave. In India, the treatment gap is 70 to 90%. It means treating people are very, very less as compared to the sick people, and which this gap can be easily filled and replaced successfully with we nurses. It is estimated that nearly 1/3 of patients who seek help from healthcare facilities could have symptoms related to depression, but poor awareness of mental health symptoms, social stigma, and lack of adequate resources and facilities stop people from getting the help when it is needed. There are only 5,000 psychiatrists in India, and 0.3% for every 1 lakh persons, and less than 2 lakh clinical psychologists. As a lot of imbalance, these statistics are showing how much is required and how much is available. And this is in view of that in few coming 10 to 15 years or 20 years, the number of sick people, mentally sick people would increase more, which will be very, very less at par with the increased number of the psychiatric clinicians. To compare the ratio of psychiatrists in developed countries, where it is 6.6% to 1 lakh population, this is very, very less in India, right? Also, mental health services are highly inaccessible, and up to 40% of patients must travel very, very far to achieve help from the professionals. Now, all these statistics was just to make a little background for further discussion into panel, and these topics we have taken into considerations, and I shall be asking the panelists through various questions. Little few lines for the audience and panelists is, it's an open forum, it's a panel discussion. After asking questions, questions also will be available to audience, and you are most welcome to write questions into chat box, and Dr. Shrija would be taking these questions later on, and you are free to express. So as well as my request to all the panelists is, if I am asking a question to one particular person, and if you think that aspect is to be elaborated more and you have something more to contribute, kindly remind me by raising your hand, and I would invite you. Thank you so much, everyone. So I feel all of us are ready to conduct the panel, those who are involved, and audience to be ready. I request all of you to sit straight and be attentive. It's an interactive session, right? Thank you so much. So I request all the panelists kindly unmute yourself, and the ECO team to do necessary arrangements for connectivity and other technological issues. I request all the panelists thumbs up if you are ready. All right, thank you so much. So here with this background of my discussion and with this burning problem, which all of us might have felt aggressively, openly, or suddenly, indirectly in our family and around us, I would like to take this opportunity to start a little discussion. My first question would go to Dr. Reena, right? Do you agree, as a mental health team, that mental health to be considered a top priority? No, when I was thinking about myself, how to go about, my first question came is, it should be the global priority. And I'm sure many audience also would be having this question in mind, where we have other burning problems related to health. So Dr. Reena, what are your views on it? You're unmute. You're muted, sorry.
Thank you, ma'am, for this wonderful question. And I thank and express my gratitude to the CNRS team for inviting me to be one of the resource persons for today's program. And I do agree with the madam that it is a global priority. We know that WHO has provided with us this team of mental health a global priority, because we know it affects, our mental health affects how we think, feel, and act. It also helps to determine how we handle stress. We know that if we are mentally healthy, even though we have some physical problems, we can contribute a huge amount of work and productivity to the community, because mental health force a person, or it work as an energy source for a person to move forward. Though we say that health definition given by WHO, we understand that we cannot separate mental health from physical health. Health is considered as one unit, and mental health is one of the important aspects of health, and it has a direct impact on our ability to take new information, understand new concept, and master new skills. So we recently I have read a lot of materials given by WHO, thinking that it has an important role in improving mental health of people in every sphere. If you are, some of you, if you are interested and if you have time, please go through all the materials given by WHO. It has a focus for all the age group, and even how a mental health professional have to improve mental health. So I feel mental health is the most important aspects which we have to maintain in our life. If we are failing, like for example, we know that we are working in this area. How many of us are mentally healthy, even being mental health professionals? So when we know that we are slipping or derailing in our thoughts, in our actions, like some negative thoughts are coming to our mind, try to come back to normal stage and understand that we have studied this to apply in our life also. So otherwise, what will happen if we...
Thank you, Dr. Reena. I would stop you here. My question was only, do you agree it should be the top priority, and which I think you have answered. I would also like to add, most of the organic problems or symptoms do appear out of our mind, right? So this is how I think I'm also getting convinced after Dr. Reena said, yes, mental health should be onto the top priority. And if we keep our mind straight here, I think most of the problems we can definitely handle and at least can avoid. Suppose if someone is abusing us, if you are stable here and if you say, let the person talk, and if you do not react, no quarrel. Mental health. Thank you, Dr. Reena. I would come back to you with other questions related, and I would with this in this connection, a question again arises into my mind is that at one side, maximum population of India is struggling with basic needs and other health issues, right? What do you think to convince? What do you have to say to convince to audience that mental health still to be kept at top priority? What I mean to see, to clarify my question, at one side we see people struggling, suppose with COVID, with cancer, with many other type of illnesses. Do you think, question goes to Dr. Jayanthi, that still we should keep mental health a priority? And can we keep? Actually, main part is, can we still keep?
Yeah. Yes. Good morning. A happy morning to one and all. And I thank the organizers for giving me this opportunity. And many congratulations to CNRS for launching your West Zone today. Yes, your question is how to convince the audience that mental health still to be kept as a priority. So as the World Health Organization famously says that there is no health without mental health. So all of us should understand this. This is very important. So when there is no health, there is no health without mental health. So this itself will clearly says that the importance of mental health. So we have to prioritize mental health. Everybody should understand. So basic needs are things that are needed in order to survive and to be mentally and physically healthy. But when there is no mental health, on the other side, we cannot enjoy the basic needs like our sense of belonging, love, shelter, whatever it is. So proper mental health results in proper mental functioning, that results in being productive in activities. This is very important, and having healthy and fulfilling relationship with other people. And this is also very important, whether it is in working place or at home, and the ability to cope up and adapt to the adversities, because every one of us are undergoing one or the other type, some or the other problems. So proper mental health.
I agree with you. You have said, okay, it should be still. But me, when I see as a person, my basic question, which I want to highlight here in this panel for the benefit of audiences, suppose I take simple, I met with an accident, or I'm having fever, or somebody shouted at me. In that condition, how to make my mental health stable? The techniques, only names to be highlighted, because in our further series of this type of panel, we would be discussing specific these activities. So can I request Dr. Reena to please say these few techniques, how in this condition still I can maintain my mental health, please?
Can I?
Yeah. Please
So
unmute yourself.
Yes. Am I audible?
Yeah.
Yeah. So there are certain measures what we need to take to bounce back whenever there is a stress. So the important thing is we have to connect with self. That is very important. So by connecting, actually we are not giving some time for ourselves to know our feelings and emotions, what we are going. So in a day, at least 20 to 30 minutes, you should dedicate to connect with yourself. That is very important. So relax and do something to, and you enjoy whatever you like. And also it could be even doing meditation or involving in exercises, going for a walk or walking in nature, or gardening, something, whatever is you like, that you can adopt. So that spending some time with yourself definitely help you to come back or bounce back to normal functioning.
Thank you, Dr. Jayanthi. A wonderful sentence you have spoken is connect with self. I think that's the basic reason we all are right now disconnected with self only. Yes. So maybe this is a great skill and great technique, which we may discuss in a further series. I won't take this today, but a little insight we have developed. Thank you so much for bringing it to the audience. And Dr. Reena, anything you would like to add upon this?
Yes, ma'am. It's what I feel is
any other technique, how to maintain mental health when you are actually in mental crisis?
Yes, ma'am. Actually, we have to adapt to the changes. We know that every day we experience a lot of changes in our life situations, even our career, our interactions with people. If we are able to adapt to the changes and understand the situations and just try to maintain resilience, it is an important factor which can promote.
Wonderful answer. Wonderful answer. Very apt. And you again gave me another very big meaningful line is adapt to change, which also we would take in our further series. Thank you so much. See how great people are here to discuss. All right, let me take, since the time we have limited time, I would ask Mr. Rakesh, can you specify common mental illnesses surfacing nowadays? Just very brief answer.
Thank you so much, ma'am, for the question. And also I thank for the opportunity to be a speaker for today's panel discussion. Okay. Coming to your question, ma'am, as all of you agree, like mental disorders, it is basically characterized by clinically significant disturbance in cognition, emotional regulation, or behavior. And it is usually associated with impairment in many areas of functioning, and it leads to disability, and it is severely hamper our quality of life. If you ask what are the common mental illness that is nowadays surfacing in the community, if you take the global scenario, WHO estimates that 1 in 8 people in the world is suffering from a mental illness. It amounts to roughly 970 million people who are suffering from mental illness. And among these, the most common disorders are anxiety and depressive disorder, if worldwide scenario if we are taking. And also there are many different kind of mental illness that is surfacing. And the unfortunate thing is that, like as you have already discussed, like effective prevention, many are not accessible to the treatment, even though effective treatments are available.
All right. So what I make out from Rakesh version is that anxiety and depression are common illnesses which we see more apparent, more common around us, and they may lead into actual precipitation of other type of severe mental illnesses. Here, interesting comments are coming in chat box. Anjali Katare says, connect with supernatural power, Almighty God, which is a very powerful sentence. Thank you for putting into the chat box. Bhumika Chauhan says, what do you believe is important for anyone? Two. I'm not getting this. Aage kya likha hai? Nahi, nothing is written. But anyway, she wanted to say, what do you believe is important for anyone? I mean to say, I think she meant have respect for others, try to understand what is right now important for him or her. Thank you, Bhumika and Anjali, for supporting us. That shows my audience are involved and they are here with the panelists, right, active. Thank you so much. My next question goes to Dr. Sreevani. Can you please highlight related issues leading to this mental health? No.
Yes.
We have discussed whether mental health is important or not. We have also discussed different types of common mental illnesses surfacing. I want you to highlight what are the common reasons for that.
Yes, ma'am. First of all, I'm very thankful to you. Madam, am I audible?
Yes.
Yes. Thank you for giving this opportunity, and special thanks to Dr. Bahubali to nominate my name for this panelist. But basically, all kind of these psychiatric disorders are longer in the sense it is a chronicity is involved. Whenever chronicity is involved, disability will be there. So almost all mental illnesses are disability associated with this illness is as equal to cancer or renal diseases like that. So once they have certain disability, their productivity will be decreased. Once the productivity is decreased, the morbidity will continue and the global burden. These are all the three sentences I want to tell, that these diseases associated with disability associated with this illness and the morbidity and the global burden. Apart from these things, interpersonal relationship, family burden, then the quality of life, these are all the things are associated with that. So once the person gets a simple depression also, the duration of depression itself is 6 to 9 months duration. Even though he is on active treatment, one or other ways his lifestyle and other activities will be disturbed. Anxiety. So almost all the illnesses are having a long run and they require treatment, especially severe mental illnesses like psychotic disorders and bipolar affective disorders required a long-term treatment. So the poor drug compliance, because of the poor drug compliance, again their work, productivity, other things will be affected and the family will be burdened. These are all the highlighted things associated with the mental illness.
Thank you, Dr. Sreevani. Actually, these are very reasons for precipitated mental illnesses, right? I wanted more clarity for the audience. All of us are mentally healthy people, those who are here, right? We do get sick sometimes in the day. In the 24 hours, we do find somewhere ranging in the fulcrum from mental health to mental illness. Sometimes you may not get angry outside, but you feel anger so much inside that you can't speak. You don't want to speak to spoil the environment. What I would like to ask other panelists, whoever is interested to answer this, is what is the common cause of this shifting to mental illness or this type of behavior from healthy to illness? Quickly we shift. What is that?
Ma'am, can I answer? Actually, it is a genetic, psychological, and the environment. These three things will make up the person more vulnerable for these mental illnesses. It is not the one correct factor is responsible for mental illness. There are so many things. The person may be predisposed with some genetic background, the precipitating factors from the environment, and all those things will combine in a particular environment. The person will show these kind of symptoms.
All right. Thank you, Dr. Sreevani, to highlight on this. Could I ask Dr. Jayanthi also to say your views on this?
Yeah, all of us have varying thresholds, madam. It depends on the individual. So everyone will react to the mental illness differently. For example, somebody is very strong, even though, as you said, when we get some problem, immediately some people will shift to mental illness. In a continuum, one side mental health is there, the other side mental illness is there. And most of us will fall in a center place only. So it is easy to move this side and this side. So it all depends on the threshold of the individual, madam. So how best he will cope up with the situation?
Very good. So I got another keyword. Should I name it as emotional threshold?
Yes, madam.
All right. Another big point to discuss in our coming up sessions. Thank you, Dr. Jayanthi. Here I can see a few remarks from Naseema Shafaqat. She says, we all talk about mental health. Cannot we inculcate some activities for promoting mental health at institutional level or regular process? Yes, you're very right. Which becomes a part of our academic or clinical plan. Like wonderful thought, Naseema Shafaqat, and you and me are faculty, you and me are teachers. We can do it if we have decided. You will feel a lot of resistance, initially, but if you are determined, we can do and we should do. Now, generation is changing. As we have seen when we were students, how our teachers dealt with. Are we dealing the same way now? I'm sure, definitely the trend has changed and the legal issues also have changed. We are really cannot deal with students. What I personally believe is we have to strengthen the person and not condemn the person in our day-to-day activities in our teaching institutions. We'll come back to again, it's a good thought, Naseema, you have shared here. And Neeta Rawat also says here, Pravina Sudhar says, how to talk with someone that you are having some mental issue. Anyway, this is a question. Neeta Rawat says, identifying that mental health exists because most people are in denial. Good idea. So questions I'm not taking, only thoughts I'm taking here. Question Dr. Shrija would be taking from the audience. Thank you, audience, for being with us. And I come back to my series of question. I come back, Sreevani, thank you for highlighting your views on the basic question of the factors leading to mental illnesses. I come back to Dr. Jayanthi and asking, it is very difficult to draw the fine line between mental health and mental illness, right? I myself do not know about myself whether right now I'm mentally ill or right now mental, and I would try to justify, as somebody said, we are in denial. I would justify, no, I got angry because I was right, because you were wrong. So how to, and then awareness has to be developed related to this. So there is a difference, very difficult to define or demarcate mental illness and mental health, switching over. Can you further highlight Dr. Jayanthi, and after that, Dr. Reena, be ready with the answer.
Yes. So I think everybody will agree with me that everyone has mental health, just like everyone has health. In the course of lifetime only, sometimes we may develop mental illness, or sometimes we maintain mental health. So, but every one of us are struggling to have a challenge with our mental well-being. Well-being is something different. So just like we all have challenges with our physical well-being, so we also face some challenges in maintaining our mental well-being also. So before understanding this, we need to know what is mental health and what is mental illness. Because when we understand mental health and mental illness only, we will be in a position to differentiate. So mental health is easy to define. Actually, when we talk about mental health, we are talking about mental well-being all the time, how our emotions work, how our thoughts and feelings, our ability to solve problems, and how we are overcoming difficulties, how we are reacting, how we are communicating in society, our social connectedness, and our understanding of the world around us, how we maintain harmony within ourselves and the surrounding. So that that will define our mental health. So coming to, and when somebody can ask, how does this good mental health look like, then it is very difficult to say. So good mental health is more than having any symptoms of mental illness. So that is simple to define. But actually, even a mentally healthy person will have some mental issues, but outwardly may not express. He may pretend to be mentally healthy, but maybe he is undergoing some issues inside. So it is very difficult to diagnose by looking at the person. And it is equally important for us to understand what is mental illness also. Mental illness is an illness that affects the way people think, feel, behave, or interact with others. So when we understand these things, it becomes very easy. Yes, madam.
Yeah, very good. Yes, completely agree with you. Yes,
Okay.
thank you, Jayanti.
So for example, some people are in good health, but have problems going out, problems in their life. Some people experience serious health problems and their poor health has a very negative impact on their life. Some people have serious health problems and last for a long time, and others have serious health problems, but they have learned to resolve that problems and they will come back to normal life immediately. So it all depends on how best they will accept the problem, adapt to the illness, and they come back to normal life.
Yeah. Thank you, Dr. Jayanti. Is Dr. Reena has to add something to this?
Ma'am, being mentally healthy is not necessary that 24 hours we are happy. So sometimes our mental health may fluctuate because of the environmental issues like others' interaction, our hormonal changes, our mood, all those things. See that we are coming back to the normal stage and not going out of the limits. So always come back, and once we finish our job, see that you are not bringing your office to the home. So whatever is there?
Yeah, Dr. Reena, you said very powerful sentences, come back to normal state. Is there a technique to come back to normal state?
Not, shall I tell what we practice? I am working in a mental health setup, actually always disturbed by thoughts, like how much we could do, or oh, this happened, or this failure happened. All this is like a fish hook. So hooking, and whenever we are doing some productive activity, this hook will be withdrawing back, pulling us back from our productivity. So what we do is forcefully preventing this thought, like unhooking. That is one of the technique. Even this is given by WHO also, very well explained materials are there. So that I started practicing actually. So do this unhooking will help you to come back. Otherwise, what will happen? We are focusing on one, even studies, our work, everything. This disturbing thoughts will be hooking us, like we can't breathe. We can't think. At the end of the day, we will feel that we are a failure. So to avoid this, we have to forcefully bring us back to the normal stage and come to the reality. That is the.
So you mean to say, in my other words, can I talk like this? We should be aware of what's going on in our mind. And if you think we are entangled and still thinking of the past, whichever has happened, because whatever has happened, nothing can be done right now. To switch over to healthy thoughts. Do you mean to say that?
Yes, ma'am.
Sure. So, but it needs practice, and people, audience here, they may say, theory ki baat karte hain, madam log theory bolte hain.
What I feel is like we are going to the gym. One day we will not develop with the muscles. It needs training. Very difficult.
Great example. So I think this is a very convincing to me as well. A practice will make you perfect. And as I listened to many other talks, so I really came to the conclusion, if we are aware to what is going on in the mind, come to this stage itself is very, very difficult. We are not aware of what's going on in my mind. So first awareness, and second, switching over, shifting regularly every time would really make a help and contribute to maintain mental health. Here, Jitu Parel says, stigma is also a grave concern to achieve mental health as a global priority. How do we tackle this issue, Dr. Reena? And this question, Dr. Reena will answer. I did not know it will come as a question, because question Shrija will take. There is another question. Okay, I should not take it. Right. So thank you, Dr. Reena. And
should I answer this?
Madam, can I answer one point? Shall I add, madam?
Yeah, please, please.
Yes. Just to differentiate which is mental health and mental illness. See, mentally healthy people are aware about their thoughts, feelings and all. These are associated with our environmental stimuli. We know something is happened, because of that we are feeling for that. But in mentally ill people, that insight is lost. They do not know what is happening to them. And also their emotions are exacerbated, not associated with the environmental stimuli. They have a perceptual abnormalities without something is not there also outside. They will be seeing and hearing. So these are all the gross things are different. We can make out from the mentally ill to mentally healthy separation. Though it is a one small minor marking is there, that is the reason. So if there is any reason we are reacting for that, we are normal. Without any reason, we are reacting, we are abnormal.
Thank you, Sreevani, for, I think this is the awareness I developed, is that mentally healthy person can be aware of his or her disturbances here, and mentally ill person will not be aware. Is it that you want to say?
Yes, yes,
very good. Thank you. That answers the previous questions as well also. And for all of us to be really happy that once we are aware, we are talking of this, means we are on the other line, we are onto this line of mental health and we have not crossed the line. Thank you so much. Dr. Rakesh, I would like to ask you one question again comes to my mind when we think, I think as a general audience is, now we are talking of mental illness and mental health so much, but maybe 1 or 2 decades or 3 decades before also these problems might have been existing already in society, but there was not much talk. Because when I feel I crossed 50, I would have been very happy person if I would have known these techniques 3 decades before when I was young. So why it's the reason that we are discussing now and not earlier, whether mental illnesses did not exist earlier? What do you have to say, Rakesh?
Yes, ma'am. Thank you for the question. It was a right question. As Sreevani madam already told, there are individual risk factors for mental illness, familial risk factors are also there, and also very importantly, environmental risk factors. So nowadays we are going in a world that is fastly growing. There are so many demographic changes that is happening, like migration, urbanization. There are increased number of refugees. We are knowing, like worldwide war and other thing that's going on. There is large influence of mass media. Open communication is comparatively reducing. We are relying more on the phone or other things. Okay, the children who are earlier engaged in play and other kind of social interaction, nowadays they were lacking from them. And also there are many people who are living in area where there is high amount of community disorganization that them pose at high risk for mental illness. And also we are talking about the workplace mental health. We all are working people globally. More than 60 people are at work. As per the WHO estimate, there are increased work stress. There is a lack of income. There is high demanding job, and there are many people are having lack of job security. All this amounts to considerable amount of mental stress that may lead to mental illness. And also other concerns like abuse, that is a common issue nowadays. And there is growing population of elderly that Royce are also highlighted. And there is increased amount of violence in the society. There is increased substance use. All this may contribute to the increased amount of mental illness. Also, another point I want to add that, like comparatively, as many people discussed about the stigma about the mental illness, I do believe that stigma gradually is reducing. So this reducing amount of stigma is one aspect that mental illness are coming out and people are started taking treatment. That's why that's one reason that we are seeing increased prevalence of mental illness nowadays.
Thank you, Rakesh. The question is answered very well and all aspects have been clear. Now, next question goes to Reena. Dr. Reena, can you say, when I take all this now we have been discussing in a little negative side, if I take discussion onto the positive side, what advices, list 1, 2, 3, 4, would you give to me and the audience, just superficially only in this session? That factor, what are the factors related to maintain mental health,
So, first, a self-evaluation. Whenever your mood is down, you assess what is causing it. Is there a real cause? Is it a normal anxiety or it's a pseudo, like we are imagining, perceiving and happening? So that we do. So if our mood is low, assess, is there a reason? If there is reason, if we can do solution, solve it. If there is no solution, don't think much. Focus on something you can do. So always I think that this is the problem, then what I can do, what is the solution? So solution focused approach is a growing area. Actually, we have to move our change from problem focus to solution focus. For example, if a patient is coming and sitting in front of me during the initial screening, I don't ask, what are your problems? I ask, why are you here? What's make you to come here? What help you want? So patients will start talking. If I ask, what are your problems? I don't have any problem. That may be their normal answer. So, and tell them how they can do the solution. For example, recently one patient told me her spouse divorced her. So I asked, which age you have got married? She told me 24 years. Now I think of suicide. I asked, 24 years you have lived happily, right? Alone, and you have done all your work. So suddenly she started thinking, yes, I was very smart and I become very dependent on him. Now I understand, I can go back. So started.
Wonderful.
So even though we can't do a lot of interventions, sometimes we may not be able to a lot, but one sentence may bring them back to normalcy. That is my experience. So I listened well, even to me. One day, I had 17 patients. I consoled them. I came to my room. I locked and cried because I was feeling sad. I have consoled them. I can't console myself. That is the reality. After crying, I understood why am I crying? What makes me? So some little life issues. Then I solved it. Wiped my eyes. I put kajal. I made makeup. I am smart. I went to class. Took class. I made it happy. So it will happen to anybody. Whatever mental health personally you are, you will have ups and down. Never be in that down. Come back. That is resilience. We will have a lot of issues. I don't say that I am lying on the bed of roses. Never. Thorns are there with roses. So enjoy roses, forget thorns. That only we can do. Otherwise,
very good awareness. You said be onto the solution mode, not onto the problem mode only. But I personally have felt either we should be so strong to come out of that problem mode to the solution mode, or we require some external force like some counselors or some friend, good friend. So sometimes it is required, otherwise you alone, we will flow in that negative flow only, right?
Someone asked me about the stigma. If I say, I told about myself because I have professionals there, everyone, they think that I'm strong. So there is a problem when I approach them, they will think, oh, this lady. So I want a person to trust. That is the common problem of every mental health professional. We know that other person may help, but we want a stranger, other professionals who doesn't know us. That is important because
fear of disclosing our loop.
Maybe not only disclosing, it may affect our professional life. If same institution we approach somebody. So we should have personal therapy. We should talk to our friends. We should really someone we should find whom we can trust and maintain confidentiality.
But yeah, absolute known person, I think a good friend, a confidential friend, real friend is real, will be good help in this.
Yes, ma'am, surely, but always the friend may console us, may not give scientific therapy. So it's better to approach a person who have knowledge,
definitely.
Skill.
Then comes the role of therapists, counselors, and we nurses should take the lead. I personally feel we have got so much of good skills, both inside hospital and in community. And counseling is our inborn skill. It comes with experience. I request all the nurses to really take lead into this. And
one more thing I want to tell, all the world non-psychologists, they go for personal therapy with other clinical psychologists, but only we are not doing that.
Definitely.
I feel we are being mental health professionals, we study a lot, we have all knowledge, skill, but we are not practicing it. When we start practicing what we have studied, then only we can say that we are also doing something, or we can protect our.
And this your version reminds me of certain court cases, family court cases where the judge has said something, and some awareness suddenly developed with the couple, and they are happily back to the family life, some external force. So this is very good. I think a friend only will be just helping you to ventilate, not a therapist. So therapeutic role is very, very important in our life, and we must go and take it. Good.
Can I add one thing, madam?
Yes.
It is like a mindfulness. This is the one it is coming up now. The mindfulness means focusing on the present situation, letting go the past thing, we have to let go the past, and the future we should not think. Live at the moment. This is the concept they are encouraging in all the disease conditions or whatever it may be. That mindfulness has attracted many research studies have done on that area, and it is proved that especially anxiety and depression, these kind of feelings can be reduced. But this is also like a practice. On one day it will not come. As we are practicing, the things will.
Like in first, I feel here is first thing is to accept that this practice can make you maintain your mental health. So my request to all audiences, please look into this and try to be very happy in your life. I request Dr. Sreevani, if you can give one or two research study reference in the chat box, my audience would be benefit and they can really refer it in their own time.
Excuse
Good.
me.
Yeah, yes.
Ma'am, I would like to add a point that these strategies should be individually tailored, like in the sense that what works best for me, that it may not be the things that will work for you or any other. So we are the best person to find out what are the things works best for us and to find out that.
That is how, yeah, that's the fundamental principle of counseling. The counselor does not make decision. It's the client makes decision with the help of the counselor, right? So this is, yeah, definitely, because what suits me may not suit others. Thank you for adding to this. And actually, my next question was to you only, Rakesh. You know, the most vulnerable group is youth, adolescents. I feel so. Because maybe after 30 or after 25, once you pick up the job, you are with your married life and other issues. But what I feel in my personal, professional life, I feel there are many students around me and many youth, and they have the productive life ahead. And India is the youth rising India in India. So what you would like to tell and highlight about common behavioral problems or common other issues like substance abuse? Punjab ko to udta Punjab bana diya. I really am scared if India becomes udta India, because many other countries, they are really want to put our youth down through this addiction. Is there anything from your side you have to say?
Yes, ma'am, I completely agree with you. Point that substance abuse problems or substance use disorders are particularly high among the adolescents and young age group. And we are seeing that the age of initiation is decreasing and the number of users are gradually increasing. And I found there are some risk factors for the development of substance use in this per se, majority are like family history of substance use. If there is a parental attitude, favorable attitude towards the substance use, or if there is poor parenting, if there is poor health, or if there is any mental illness, or if there is lack of academic connectivity, lack of schooling, all these factors are posing that them at higher risk for changing into substance use behaviors.
Right.
And also we know this age group, particularly adolescent, that is a changing age group. They were neither child nor adult. So there is a transition stage. Cognitive, emotional and behavioral changes are happening. Physical changes are happening. So how they adjust well to those changes, that will matter whether they will adapt healthy behavior or non-healthy behavior, like changing to substance use disorder. So there are so many vulnerability that is happening.
Thank you, Rakesh. And maybe in our next sessions, we can focus more onto these specific problems. Here, I see a very good remark by Anjali Katare. She says, for the long-term solution, the best technique is breastfeeding exclusively, unconditional love, and being non-judgmental attitude. And I would like to pick up that breastfeeding exclusively, which is related to the suckling behavior of newborn, and many of the adulthood disorders, mental disorders, are related to bad childhood experience. And I read a lot about related to this is that breast suckling, that tune the person, the baby, so well grooming, emotional grooming, maybe some emotional satisfaction, further research to be done, or more studies I have to do on this. I cannot speak much, but yes, very good point said by you, Anjali, is that exclusive breastfeeding, and which we nurses are again can work. But a lot of awareness to be developed. Nowadays, trend is baby is born, mother should not feed. No, upper class, middle upper class people also, they don't believe in exclusive breastfeeding. So I think it's a wonderful insight, and we all have to look into this. And please educate yourself, your near and dear ones in family and professional neighborhood. Thank you, Anjali, for making this remark. Here, in this relation to the discussion of youth, Dr. Jayanthi is working in College of Nursing in NIMHANS and dealing with adolescent students. And I also personally feel the upcoming youth are really misguided. Then they have a very vague picture. It's all fog in front of them, where to go, how to go, they really do not know. So Dr. Jayanthi, do you feel that we nurses have a role to maintain mental health of nursing students, specifically nursing students?
Yes, madam, definitely. And one thing we need to understand that mental health problems account for around 16% of the global burden. because adolescence is the period of transition from childhood to adulthood. And most of our nursing students fall in this category. And I think all of us agree with me, nursing is one of the stressful and challenging profession compared to other university studies. I think you will agree with me. And our students also are required to meet multiple theoretical and clinical requirements that itself give rise to a lot of stress. So they are undergoing academic stress in the form of writing tests, submitting assignments, presentation, and various other things. And when it comes to clinical stresses will be there, like they will have fear of making mistakes, and negative responses towards death and suffering of the patients will be there. And because it is learning for the students, because they have to interact with various other multidisciplinary team also. Sometimes they will have a fear communicating with others. And also, in addition to academic and clinical stresses, they also have some social stresses, personal stresses will be there. It could be of a financial problem, or maybe they are not able to manage this new course, working with the patients and other things. So all these things will lead to anxiety, depressive symptoms, and self-destructive behavior among these nursing students. And also, I think adolescence is the time of imitation. So they learn by imitating others. So they often imitate the behavior of adults they know or they like. So they become addicted to smoking and alcohol during this time also. Because to overcome stress, maybe they are adopting this particular behavior. They think that this is the only way to come out of the stress. So this impact leads to depression and anxiety in students. So that will show in their academic decline. They fail in the exams, they score very less marks. So all these things will be there.
Right. I also personally feel that nursing students are expected to behave double of their age. 17-year-old is the minimum age, 18-year-old,
Yes.
and when they're going out, they're around 20, 21 or 22, and we are supposed to expect from them as if they should understand all age groups and all problems, whereas in other professions, it is not much required. You take MBBS, you take pharmacy, you take paramedical, physiotherapists, nothing is expected. So I personally feel our curriculum also is so much of burdensome, so much of work.
Yes, madam.
And maximum work is expected from nursing students, whether it is clinical hands-on training. So anyway, this is out of the way question, but yes, it's one awareness we have to develop because we are dealing with all nurses and nursing students. Here, again, interesting remark by Anjali. Dr. Uma Handa's study is on importance of breastfeeding, the very meaning of word nursing in nutrition and breastfeeding. Thank you, Anjali, for enlightening us. So I come back to my questions, and here, when I was talking about nursing students, I have Ashley Abraham, a student from India, but settled abroad. And I would request Anjali, with permission of the panelists, can you highlight how nursing education, nursing educators are really important to maintain mental health of students? Ashley, are you with us and can you hear me? Oh, Chris, can we unmute Ashley? She is writing in chat. Let us hear from the student what they feel. Now she's passed out, but let us see. One sample. Answer.
It's mute. Anjali ma'am is muted.
Ashley, A-S-H-L-Y, Ashley Abraham. All right, Chris, can you let me know when Ashley is unmuted? We'll call her immediately after that. Hello?
Ma'am, she can unmute.
Ashley, please try. Hello?
Is she joining from another person?
Ashley's writing in chat box, still mute. Please unmute me. She's still telling.
No, she's caused only. She can.
Can I speak? Hello?
Yes.
Yes, as an academician.
Anjali madam will take you next. I will call
Okay,
you.
okay,
I'm
fine,
calling
no problem.
Ashley. Ashley Abraham, I'm calling. All right, let me further proceed with my questions. We'll call Ashley. Chris, can you please take care of this issue?
Yes, ma'am, you please proceed.
All right. Dr. Reena, my next question goes to you is that as we focus on the middle age group, what you have to say about their mental health? I mean to say, are they really in the midst of the life with all responsibility, liabilities? They are not happy. What are the reasons you say? Please highlight on this.
Shall I speak from my experience in dealing with this type of people? So once they are like settled, they are achieved their career, their everything, but when they look back, most of the people have thought that they have made wrong decision in their life, like selecting a partner, selecting a career, and even their parents are aging. They can't go and take care of them, and even their children, if there are children, they are leaving home for studies, and they are actually not free. They have settled in their career, but they have a lot of frustrations. Plus, they have to deal with their relationship issues with their spouse. That is one of the most important issues we have observed. Because what one lady has told during the sessions, husband started showing love in the after retirement. But she is not agreeing because when she wanted, he was not giving love and affection. Now she is not in that interest. So she is telling now this point why he is showing love. When I wanted care, concern, it has not given. Then this frustration starts and it is extended to kids, daughter-in-law, everything. So this is one of the, if we can strengthen our family, I think most of the issues can be solved, mental health issues. Most of the illness are starting from the family, not from the outside. So if family members have some relationship, understanding, and not expecting much from other person, expect much from self, not from other person, and give freedom. For example, if I believe if I want to do something in front of others and they hide and do it. Something, if husband wants to send a message to somebody, he hide and do it, which he can't do in front of his wife. If this freedom is there to interact with others, not suspecting husband or wife, so I think most of the issues, like we should be free, think freely.
Right. All right. So very well said. You have really made me see vividly what exactly happens at middle age, and see how middle-aged people, if they're not in mental perfect harmony, how will they affect their own children, which may be adolescents now, and the aging parents. So it is affecting double sides. Thank you, Reena, for bringing out many burning issues. And I think definitely we must go ahead with specific issues discussion in our upcoming series of webinar. Right. My question next goes to Sreevani. What are the responsibilities you would advise a nursing professional should take to build mental health of people at community level, and how to identify vulnerable groups in community? Brief answer.
Yeah, ma'am. It is like nurses' responsibility. First and foremost cause for mental illness is lack of mental health literacy. People are not aware that those are the signs and symptoms of mental illness. Many people have a low mood. They will think it is a part of their life. Many have a lot of aches and pains and all. They will think it is a common after certain age. So if they are aware of those things, definitely some people may have some suicidal thought. Many people have a notion that mental health is because of their fault. They are unable to control their things. That is their fault. Because of that reason, they will not meet the doctor and other things. Nurses have to take certain responsibility, like recognizing the vulnerable individual in a home visit time, or otherwise maybe a school mental health programs, college mental health programs also now we are conducting, especially in women colleges. We are going and talking about that pregnancy related issues, how they have to cope up. Then intrapartum, then postpartum, what are all the common mental illnesses whom they have to approach. These things In the college education, we can be. Apart from that, there are some jatas will be going on, like a Krishi Mela. One of the jata here, all the farmers will join. In our part of Karnataka, actually, this part of Karnataka, suicidal rates among farmers is very high. In those jatas, if we have a one stall related to mental health and depicting all signs and symptoms, and one counselor is sitting, that will give a awareness. And apart from that, Sahitya Sammelna, in a state-wise Sahitya Sammelna will go on. During that time, we can request that higher authorities and one free stall can be given. In those areas, if we have taken an initiation and having those free stalls and there the signs and symptoms of mental illness, what are all the myths and misconceptions, then what are all the facts, then whom they have to. And apart from that, now, so many helplines are available, suicidal helplines and healthcare, the mental health related helplines are available. If the people are aware about those numbers and all, immediately they can call. As you rightly said that resources are very less. Like how we have a obesity clinic, pediatric clinic in every street, we cannot find a psychiatric clinic in everything because the resources are less, and even the incidence and prevalence also compared to physical things, it is less only. In such a situation, what happens, people do not know where to go, even though they may be suffering, or it may be a very far. And another thing is that mental health program has initiated that including mental health services in the general health services. Because stigma is attached, someone has to go to NIMHANS or DIMHANS means they have a stigma. They cannot tell to their neighbors or family members. They can say that I am going to district hospital or medical college. There is a separate unit of psychiatry department is there. From there they can enter and the stigma will be less. And even in the primary health centers and the community health centers also, now they are introducing these psychiatric services available or making one counselor so that they will screen the people.
All right, Sreevani, in this relation, I came to know that you are having very specific extension activities, some models. So can you please highlight on that?
Yes, madam. It is like, as I was telling that Krishi Mela, that's what you want to highlight me, madam, what we are doing there?
Yes, model.
Yeah, model. Okay, so present models are telenursing is the best model because we have a less resources and it is very cost effective. Many of the people are having mobile phones or digital phones with them. So we have many projects we have conducted on telenursing, improving the drug compliance among mental ill people. And also now TeleManas, this is the one in World Mental Health Day on 10th October 2022. Prime Minister has launched this program. It is 24/7 bar. The services are available. Helpline is given. The nodal center is the NIMHANS. Then the all over the means one of the center, our NIMHANS also, DIMHANS also one of the center. Here we have certain computers and counselors are they trained counselors. We will be sitting in front of that computer. Whenever the calls comes, we will be answering them. We will screen them whether the person is required mental health services or by simple counseling things will be solved. So that we will differentiate whether it is a normal phenomena where they have to see the doctor. So if that is called as tier 1, tier 2, tier 3, like that phases are there. In the tier 1, the counselor will answer the call. In the tier 2, if is that the person is suffering with mental illness, the call will be transferred to tier 2 person where the psychiatrist will be available. Psychiatrist can have a chat with the person. Now the video is not there, only audio facility is there just because few days before only it is launched. So later the audio also will be available. The basic information the psychiatrist collect and they have a certain protocols and e-pharmacy through e-pharmacy medications.
Right. So how, suppose if I want to take help from TeleManas, how do I go about? Is there a website?
Yes, madam, it is a toll-free number 14416, madam, 14416. I have certain brochures. If you allow me, then I will share that screenshots. 3 slides are there. What exactly they are doing? That
please go ahead. Please go ahead.
Yes, ma'am.
All right. Can we make Sreevani co-host?
Yeah, ma'am, she can share, ma'am.
Yeah. TeleManas, she said.
Yes.
TeleManas, a new portal. Yes, please.
Yes,
go.
madam. Tele-mental health assistance and network across the states. It is an initiative launched on the occasion of World Mental Health Day. So I has already told that the toll-free number is 14416. Anybody can call any part of the country, this India, the person can call, and here it will ask which language. Based on that language, the particular state it will go. That language person only will answer. So there are presently 23 tele-mental health centers are there, and one of the center is ours, and we and our students are trained in this digital technology. And next thing is, yes, this is a thing. 5 regional coordinating centers are there, and 21 plus mentoring institutions. In 51 centers, they want to increase, and this is a tier 1 and tier 2. As I said, the call will come to that particular center, because based on your language, it will come to that particular state. In the tier 1, the counselors will be there. These are trained mental health professionals only. They will screen whether the person is required any further services or it can be solved. They also can give counseling related to that. If they feel that the person is suffering with mental illness, the call will go to tier 2. There the professional psychiatrist will be there. Through e-pharmacy, the medications will be given to them. And these are certain protocols are there, only those medications are, otherwise the nearest psychiatric hospital which is there, they will tell, and they can go and take the treatment there, and it is linked with e-Sanjeevani.
Thank you so much, Sreevani. I think it's a very important information, and it's a lifeline. Any of us, or we can pass on this information to society, and let us do good job. Something very nice you have contributed. Thank you so much on behalf of all the audience. Sreevani, thank you so much for discussing. Now, my one question last, just to touch upon the concept and just to make the today's discussion a comprehensive one related to mental health is, Dr. Reena, can you please enlighten on community extension services related to tribal people?
Ma'am, actually, district mental health program is focusing on everyone's mental health, but unfortunately, some of them were left in some rural areas in the beginning. So IMHANS started an initiative to find how many people are suffering from mental illness among various tribal groups, especially in Wayanad, a remote area. So they have screened and understood that some of them were left. They were doing their tribal practices. Actually, they are very pure and not adulterated with our type of life. They practice their traditions, they have their own medicines, but how much it is effective on mental health was the question. So we cannot prevent them using everything, prevent them using their traditional methods, but educated them to take medications. And home visit is there, a team of psychiatrists, a general physician, a psychiatric nurse, and a psychiatric social worker is visiting this tribal area and providing medications. And some of they are not educated and don't know how to read and write. So the medications cover is made in such a way that, like sun is just sunrise, that picture is given for morning medication, then afternoon medicine, sun is on the top. So the pictorial representation is given on the cover of medicine. And this type of medicine, patients are showing, some 90 patients have registered totally, I think, in last year, and they have shown improvement. And when there is need, they are referred to mental health centers, because the mental health centers, government centers in Kudiravattam, Calicut. So they have to travel a lot, like 3-4 hours to reach here. So if some of the issues are tackled there itself, they don't have to come for admission. If there are need for admission, they have to come here. That is happening in our tribal mental health area. And people are responding well to this. Initially, they had problem, but they are responding. Our motto is reach the unreached. They cannot come to us, reach to their doorstep and provide mental health. So nurse is there. She's giving medications, distributing, watching them, and informing us. If anything extra she needs training, she's coming and asking us to give training, and it's under our observation. So it is going on well. Most of the people have issues with the substance use and some untreated psychosis, like psychotic features. And nowadays they are taking medications. They are well versed in their treatment. When they are approaching, this team is approaching, they are opening their door. Initially they were not accepting us. because we are going through the promoters like a tribal, and it is supported by, initially it was supported by Social Justice Department, and now it is under tribal department. They are funded for medications and this traveling. One vehicle is.
All right. Thank you, Dr. Reena, for this wonderful information. And to sum up my little few concepts of today's mental health, this discussion on this topic, I have left few concepts like geriatric group. We have not touched pregnancy. We have not touched children's group. We have not touched, which I would expect all of us to gather again in future further. To sum up, what we have gathered is, one is this DIMHANS concept, and one few powerful sentence for audiences: connect to yourself, adapt to change, and emotional threshold to be increased. So these are certain takeaway points which all of us can carry with us and work on it again. We will be meeting again in near future with all informations can be given. Thank you so much, all the panelists, and I excuse myself if I have hurt anyone or I have abruptly stopped someone, because it is not done deliberately. Here we have one audience, Anjali Katare and Ashley, would like to express if tech company tech sites say they can allow. Thank you so much, everyone. Back to Bahubali. Thank you.
Ma'am,
Yes,
we have question answer sessions, no?
Yes,
no, I'm going to
Reena would be
facilitate
taking.
that. Yeah.
Okay.
Yeah, thank you, distinguished panelist and dynamic moderator, ma'am, for touching the untouched part of mental health nursing care, especially at grassroots level, and bringing the subtle matters of mental health and mental illness and balancing of the same. Now, I request Professor Srija Vijayan, Joint Secretary, CNRS West Zone, Professor, to take up the Q&A section of the program.
Thank you so much, sir. Thank you so much, sir. Hope I am audible.
Yes, you are, ma'am.
As a majority of the question already has been taken, and it is very fruitful discussion. The only one question I think it is left that is untouched, that is related to mobile addiction, that ma'am already addressed, that the children aspect has been not touched. So how to approach that part? That is the one question in the chat box. And the adolescent related issues. So I request panelists to comment on it.
Yeah, can I answer this question?
Yeah, ma'am, sure.
Yeah, mobile addiction is very much increasing, but it is not like a one solution we can give. The parents' parts also very much important. Cognitive behavior therapy, and it was very effective in those things. And limit time setting and following the limits, like only particular time they have to use and keep aside. Still they have a problem like a alcohol abuse, like that, internet addiction. Definitely they require the professional help. If they can keep aside for some time and they are able to focus on the normal activities, then definitely they can have a control. But therapist to help is required. It is on minimum 3 weeks therapy is required, cognitive behavior therapy, to set back from those things, because it became everybody's important part in our life. We can't keep aside also. That is why the limit setting and reinforcement techniques, behavioral techniques, combining with the cognitive things, that monitoring that every day how long they are using. Then once their use of mobile phone is reduced, from external reinforcement is required from them. So it is like a contingency management attached to the cognitive behavior therapy. Definitely it will work. And we have to see that whether in which stage they are there.
Is there any helpline available for the same if the parents want to reconnect with that thing?
Yes, same helpline. Any kind of problem can be asked. But basically what we have seen in our hospital is, these mobile addiction is very common, who have a social phobia and who are suffering with anxiety and depression. Maybe they may be suffering with obsessive compulsive disorder. When they have a underlying these problems, those people only more addicted to these things. When we treat this underlying problem, definitely that addiction also will be reduced.
Thank you, ma'am. Thank you so much. One more question is there, that if we... Yeah.
And also I would like to add that there is
Yeah.
a center for addiction medicine that is started in NIMHANS Bangalore. So we had listened to a session by one of the faculty there. So ma'am, the audience can view the center for addiction. There are materials are there and website, some courses are there. So they can go through, ma'am. Center for Addiction Medicine, NIMHANS Bangalore.
Thank you, sir. Thank you, ma'am, for this fruitful discussion. One more question is there.
Children should not be left without doing any activities. They should be engaged in some or the other activities. If kept idle, they have a tendency to use the mobile phones. See, this mobile phone has taken away these children. Now they stopped going out for play or something. So the children should be encouraged more and more to go out and play with other children. And also they should be enrolled for some dance classes or some games or some other activities, so that they will be engaged for a few hours, so that they will be disconnected from mobile use. So this is how we can increase them in involving in some other fruitful activities than sitting idly with the phone.
That's great, ma'am. Thank you so much.
Ma'am, Srija ma'am, through actually Google has provided one service, like most of the children and the parents are using Android phones. So through Google, like the family, the app name is called Family, wherein we can impose some restrictions of usage for the children, which app they can open or what time of the day or how many hours of the day they can use. That all we can set, and we can visualize whatever their browsing histories and things like. So we can have that, as Madam Sreevani ma'am said, that we can put some external restrictions through that app, and it's working wonder actually. Thank you.
Yeah, ma'am. Thank you, sir. Thank you so much. One more question is there, ma'am, in chat box, that as we know that the mental health issue is a stigma. So if we are knowing that some of our colleagues or known person having some mental issue, how to approach them, how to gain the trust that they reveal their problem with us. So how to approach to that particular person?
I think Dr. Reena can answer this.
So you have asked if any colleague, anybody is suffering from mental illness, how to address, how to approach them. So one thing is there, if someone is suffering from mental illness, they won't reveal us. If we can't tell them that you have this problem, you have to go to the doctor. We can't tell them like that because they won't come to us. Once you observe this, talk to them, make trusting relationship with them, ask them, do you need any help? You tell them, I take help when I am in need. Do you need same help? We ask like that. So sometimes they tell, I want to reveal this, that. So first they will observe us how we are living in an institution. If we are confidential in the sharing matters with others, or we do gossip, if we are example only, they will come to us. Otherwise, they won't come to us. They will be afraid of us. So one thing is better to stop our talking too much to others, lose talk, concentrate in your work. Unless you have some trusting relationship, talk to them. Otherwise, what will happen if you are always talking about somebody's issues in the college or institution, people will never trust us. If you want to talk gossip with somebody else, not in your institution. After your job, you do it. If it's giving us pleasure, we can gossip with someone else out of our institution, not in the institution and job place. So trusting is very important, and approach them without negative image that they are mentally ill. Tell that I think you need some help. You do want some mental health help. So everything is in our mouth. It is a sentence how we approach. Otherwise, they will slap us and tell, do you think that I am mentally ill? And we want, no one will accept it. Even a mentally ill will never accept that they have issue.
Yes.
Yeah, ma'am, true. And that's very true. Yeah, ma'am. Jayanthi, ma'am.
Yeah, actually, it's very difficult for us to go and address to their colleague. Rather, some of the action steps the employers can take in case if they wanted to look into mental health, the needs of their employees. Some of the action steps the only employers can take, like doing periodic mental health self-assessment tools can be provided to the employees where they have to fill the forms, and some clinical screening for mental health, depression or anxiety, minor mental illness. The periodic screening can be done for the employees, so that is how they can identify and they can help them to come out of that problem. And also, like the employees can also organize some of the lifestyle coaching, counseling, and self-management programs, or problem-solving skills, or what is that, a life skills program for the employees. So that is how they also can identify, they can recognize that they are having some mental health issues and they can seek help.
I would also like to contribute, like we have annual medical examination in all companies, all of us about 30, about 35,
That
we all
is
should.
restricted to only physical examination.
It is only physical and organic examination,
Yes.
mental examination is not done.
Not done,
So
not
which
done.
also should be included. In
It
that,
should be
right?
included. So then that is one way we can identify the problem.
One more thing I want to add is live for yourself, at least 30 minutes per day, spend time for yourself. So otherwise what will happen, 24 hours we are living for somebody, at the end of life we will feel we have spent our life for somebody and we have not lived. That may lead to sadness of who knows. So daily 30 minutes for you, at least to read a book, to listen music, or to listen, watch film or comedy or dance or do exercise. Even if it is after 10 o'clock night, after all job, spend 30 minutes, then only go and sleep. So what I'm practicing only, I'm speaking. Once I started this changes, I will tell you, I had 85 kg weight. Now I am 69 after starting exercise. Once I thought I am stepping into depression, looking at my body. So one problem is body image disturbance, what I observed in middle-aged group and all of us. Like we have to take care of ourselves. You want to dye your hair, do it. You want to wear a dress, you do it. You live for yourself. Don't think that what others think.
Again, to practice this and to bring this awareness into us will require practice, because I'm telling myself, all know that I know this theory and I'm determined many times I must do this. I've never done. And now I'm also bloating up in my size and I've decided I must walk. And we ladies all the more have to, because we live for others. We think it is my job to look after all family members, but we really forget and we only suffer later. Or this is a great insight. Thank you, Reena, for bringing it.
Thank you so much. And ma'am, it's true, because all professionals and our workplace need to be inculcate some schedule for mindful meditation or kind of a relaxing session at least once in a week, so that the staff and the professional get de-stress themselves.
One more thing, which I always, now I have reached to conclusion, we must not expect from others to look after us, including husband or wife or children. It's we have to look after ourselves. This is again a great thing, great awareness. Thank you.
One question from Anjali Katade. She actually asked 2 or 3 questions. One is about the live-in relationship, and another one regarding the late marriage, that the youngsters are not nowadays committed for relationship. So can you just comment on it?
I think this things, many of these specifications are endless and we have otherwise not touched other concepts, and I'm getting pressure. We have exceeded time. We may touch up these topics maybe in our upcoming sessions, and we can have open discussion.
Thank you. Over to you, sir.
Yes, Professor Srijaman, thank you so much. And thank you all the panelists and everyone who contributed in the Q&A section. So, respected panelists and moderator ma'am, we now foresee the need for making the mental health and well-being a priority, and how we nurses are instrumental in making this a reality at global arena and to ourselves. Thank you so much once again, everyone. And here we reach to a last part of today's program, and I now call upon Professor Rakesh Joshi, Secretary, CNRS West Zone and Principal, Ratnaprabha College of Nursing, Gujarat, to render a vote of thanks. Yes, please, Rakesh Joshi.
Before that, I would interrupt. Would like to invite Brigadier Mala Singh, Advisor, Western Zone, CNRS. Okay. Can you please unmute yourself and speak, madam? She's not here. Madam Mala, are you here with us? All right, we can proceed, Rajesh, please. Dr. Rajesh, to proceed with vote of thanks.
Please
unmute Rajesh, sir. Chris Thomas.
All right.
Ma'am, Mala Singh, ma'am can speak if she need. If she can speak, huh? Brigadier
all
Mala
right.
Singh.
Thank you, Chris. Can I request Brigadier Mala Singh, Advisor, Western Zone, CNRS, to kindly unmute and say a few words? Please unmute, madam.
Yes, sorry. Good afternoon to everyone. And actually, I was trying to unmute. It was not getting unmuted since long. And sorry for you all waiting for so long. This was an excellent performance by the panelists and very well dealt with these days topics, whatever current trends and problem in mental health. Since now we are in the era of technology, so and it's because of that people are getting more isolated. They are only glued to their technology or with the mobile or app, and also that is why more mental health problems are coming, and which has been dealt by all the panelists. And it is a very wide topic, which I appreciate that within 1 hour, you could bring most of the points, burning points, and discuss very well. I appreciate the audience who participated and have brought their doubts and comments and contributed in the discussion. It is very well done, and due to the dynamic leadership of Dr. Rekha Gupta, who is moderator, and the expert panelists whom I have come across or have known since long. So I was happy to see them on this panel, and I wish like this way things will keep on going. And there are points like these days one imposter syndrome, which is being means it is a recent terminology which is being used for the people who are very over anxious if they doubt their ability despite performing well, and because of their anxious people are more anxious. Means this is a separate topic which can be taken later on also, but this is also part of mental health problems. That is the thing. And one point was there that it is difficult to tell the people that they are not behaving in mental healthy way, and those, and they are in the environment, they are with us, they are in the organization, they are at home, and but it becomes very difficult to communicate to them. Though Dr. Reena and Prof. Sreeja and other panelists also have given the ways to tell them, the most problem comes, they don't have insight into their behavior, in their problems. That is why they are not able to change themselves. Though they are not mentally ill, but that is a very fine demarcation between mental health and mental illness. And that is why they are not cannot be categorized into mental ill also, and cannot be categorized in full mental health also. So we have to find a ways, as you all have discussed also, how to communicate to them so that they are aware and they can be brought into the stream what is as per the social norm, accepted behavior. So thank you very much, and I won't take much time, otherwise it is very, because this is also my specialty. So thank you, and it is a very good topic which has been dealt with a great expertise. Okay,
thank you, ma'am. Thank you.
Yeah, Rajesh sir, please proceed. Thank you.
Yes. Good afternoon to all, respected honorable chief guest, esteemed panelist, guest, and delegates. I, Rakesh Joshi, Secretary CNRS West Zone, would like to propose a vote of thanks on behalf of CNRS West Zone. At the outset, my remembering Almighty God, I express sincere acknowledgement to Eco India, a non-profit organization who serves as the operating system for healthcare in India that is fully integrated into the public health system, who had facilitated our live webinar, and we are so privileged to host it with the collaboration of Eco India. I express my sincere gratitude to today's chief guest, Professor Dr. Roy K. George, TNAI National President, whose gracious presence really made this event more valuable and inspirational. Thank you so much for joining us. I owe my gratitude to all the esteemed panelists, Dr. R. Sreevani, Dr. K. N. Jayanthi, Dr. Reena George, Dr. Rakesh V R, for your expertise deliberation on mental health and nurses' contribution toward making mental health a global priority. I hope the participant had overwhelmed with the deliberation by your expert session. Thanks to all panelists once again. I express thanks to Professor Colonel Rekha Gupta Madam, who is leading our CNRS West Zone. Her support is incredible to us, and thanks to all our CNRS West Zone committee members. I express my sincere thanks to Brigadier Mahala Singh, Nursing Advisor to CNRS West Zone, for your motivational words. Special laurels to National Office Bearer of CNRS, who has constantly and uninterruptedly supported us to make this event memorable in the history of CNRS West Zone. I am in depth all the live members of CNRS, and especially CNRS members from West Zone, for your support for the growth of CNRS. I would like to thank our valuable participant who has joined with us and enthusiastically attended the launching session, panel discussion, and question answer session. We believe the discussion
Hello, Rajesh, you're mute.
Thank all the technical support team of Eco India, guests, panelists, national committee members of CNRS, CNRS West Zone, delegates, including beloved students, and other who had directly and indirectly supported us to make this day a very informative and successful. We assure that we will come again with another sessions of webinar, online discussion, courses, research project, lectures, and competition, etc. You are most welcome to join CNRS. For that, you may visit our website. The e-certificate of today's session will be mailed within 2 weeks. So thank you so much for participating this webinar. Thank you. Over to you, Dr. Bahubali.
Yes, thank you so much, Professor Rakesh Joshi, sir, for expressing the token of gratitude to all the personnel involved in today's mega event. Now we have reached to an end part of the program, which is left with the photo snaps. And before that, I would like to thank the national team of CNRS for guiding us and motivating us and to take up this task. And I congratulate my office bearers that I can understand how it feels for us to conduct it within these all hassles. But thank you so much, Madam President of West Zone and all the office bearers. I hand over to Chris Thomas. Over to you, sir.
Yes, thank you once again. So this was really a successful and most memorable. So next time we are really sure that we will come with different types of activities. And once again, I am thankful to the chief guest as well as the esteemed panelist. You really done your part. As we can see in the chat box, the chats are so much overwhelmed. The people are so much overwhelmed with the activities you are doing. And definitely we hope the mental health practitioners will increase in our country. And definitely we will be like soon we will reach in the top of the world. Our country will reach top of the world in terms of all specialities. Once again, thanks to all for making this event successful. Thank you once again.
Thank you.